Good evening, Dr. Holm and viewers. Our medical miracle is becoming a nightmare. It has been 70 years since antibiotics revolutionized healthcare and saved millions of lives. Antibiotics like penicillin, amoxicillin, azithromycin, Cipro, tetracycline, all miracle drugs have been phenomenally effective in treating debilitating and deadly bacterial diseases. We have milked these medical miracles for all they're worth and more. Unfortunately, however, over the years, antibiotics have been misused, overused, and abused by doctors and patients, veterinarians, pharmacists, consumers, livestock producers, hospitals, nursing homes, and industry. All of us. Although bacteria are microscopic, they are very complex and clever. They fight back. Through genetic mutations, bacteria have developed potent defense weapons to resist antibiotics. The generation time for a common staphylococcus is just 30 minutes. Over a short period of time, these disease-causing bacteria can produce billions, trillions, centillions of new staphylococci. A slight mutation can produce the ability to resist antibiotics, which is then passed on to the next generation of bacteria. And now the nightmare is upon us. We are approaching the end of the antibiotic era. Our miracle antibiotics are becoming ineffective and no new antibiotics are in the market pipeline. Antibiotic resistance has serious consequences as infections become more difficult to treat. Procedures like organ transplants and cancer treatments are prone to bacterial infections and becoming much more difficult to manage. And antibiotic resistance is not something found in some far-off country. We are seeing antibiotic resistance right here in South Dakota. This is our problem. Here in South Dakota, we have urgent threats of carbapenem-resistant Enterobacteriaceae. There are 7 things that we as citizens can all do. First of all, be aware that antibiotics are not useful for viral or fungal infections. Secondly, discuss your treatment with your doctor on why or why not antibiotics are being prescribed, and then follow the guidelines for their use. Thirdly, don't pressure your doctor into giving you an antibiotic. Fourthly, use antibiotics only when necessary. You don't need antibiotics to treat the common cold or influenza or your child's green snot or mini urine infections. And then if you're prescribed antibiotics, make sure you take it until it's finished, not just take a few pills and then quit. But if you have leftover antibiotics, dispose of them properly and safely. And lastly, as always, practice a healthy lifestyle.